Start off with booties. Put one over each foot. Then move on to the bonnet and make sure all of your hair is inside the bonnet. Put the mask on over each ear and make sure the mask covers the nose. Open the faucet and then apply soap and be sure to scrub your hands vigorously. Wash for 30 seconds. Rinsing hands and forearms with running water, running down to the elbows. Using a paper towel to pat dry hands. Lastly, use hand sanitizer after you're done washing your hands. After you're done washing your hands, put on the rest of your garb, which is your gloves, your gown, and then hand sanitizer. Properly gown and PPE, making sure no skin is showing. To clean the hood, you want to make a puddle of sterile water that will be absorbed by the lint-free towels. You first want to start at the top of the hood and wipe only one way, which is from the top to the bottom, and do not forget to wipe down the pole and the rings within the hood. Next, you want to wipe down from the top to the bottom on both sides of the hood, and do not forget to wipe the outlet in the same direction. Do not spray directly into the laminar flow hood. We are going to use lint-free towels by spraying alcohol outside of the hood. Start from the top, back, and forth. Clean the inside of the hood, top to bottom. Lastly, clean the surface side to side. For sterile compounding, you will take out your products out of the basket and make sure that they are 6 inches away from you, as well as 6 inches from the filter, and lay them out in the order that is easy for you to use as you are compounding. As you are unwrapping your products, make sure to put all plastic trash into your trash container so that your space is not cluttered. Before you begin compounding, make sure to sterilize any ports that you might be adding things to. This includes the stopper for your top of your vial. Carefully uncap your needle, making sure not to poke yourself, and then draw up air for the amount of fluid that you're going to need to pull out of your vial. Once your needle is ready, you can insert the vial using the 90 to 45 degree method. That way you don't accidentally mess up the rubber stopper. Next, you're going to put the vial over that you can draw your liquid first inserting air and then slowly drawing out the liquid you need. Now that you are sure that you have the right amount of solution, you can now insert it into the port to the side and make sure you are not blocking any airflow from the point of where the needle meets the stopper, and slowly insert the medications.
Once the medication is in the bag, you can take it out and slowly put your cap on, using the scoop method to make sure you do not poke yourself. Once you have taken your needle off, you should not put it in your normal trash bin. You should put it in the red sharps container where any sharp needles as well as broken glass should be in. Now that your compounding is done, you should put everything back in the tray.
And pull the syringe to the point of the medication you brought up so that you can give it to your pharmacist for review. And they will double check that you pulled up the right amount of medication by verifying with the syringe you gave. Then she will sign off on your patient label.
And you will put the bag to be sent out to the patient.